Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue Salt Therapy Part 47, Silicea-3. Silicea for male genital symptoms. Male genital symptoms, chronic syphilis, induration of penis. Induration of penis means actually hardening of the penis muscles. This is a very incurable type of disease, hardening of the penis. When pus discharging starts in prostate inflammation, hydrocele. Hydrocele means accumulation of fluid in testicles. Elephantitis. Elephantitis also that type of looking like hydrocele, but it is much heavier than hydrocele. In this case, there is tissue formation, not only fluid, huge tissue formation, extra unwanted tissue formation is there, and the thing looks like elephant legs. That's why the term elephantiasis is coined. Chronic gonorrhea with thick yellow discharge, severe itching in scrotum with copious sweat. Silicea for female genital symptoms. Ice cold sensation over whole body with onset of menstruation, profuse acute discharge, corroding and burning sensation over skin where it touches, burning around vaginal opening, excessive sex desire, acid, thick, milky, profuse corroding, white discharge, boil in labia, fistula, constipation, fetid, sweat in feet, salpingitis. Salpingitis means inflammation of this tube. These are called fallopian tubes. This inflammation of fallopian tubes is salpingitis. Hydrocele means the same thing. Here, not only inflammation, the accumulation of water. Hydro means water in the salpinx, that is fallopian tube. Silicea for abdomen and stool symptoms. Abscess in liver. Abscess in liver. This image, liver indurated, abdomen of children swollen, hard, hot, stool very fetid, hard swollen lymph nodes in groins, colic from worms, intensely painful piles, discharges are thick and yellow, fistula and or fissure in anus, fissure. Actually, in rectum and anal canal, there are three important diseases. One is hemorrhoids or piles, other is fistula, another is fissure. All the three diseases are tackled by Silicea quite competently. Fistula, anus, paralytic condition of anus. Paralytic means semi-paralytic condition. Constipation due to partial paralysis of anus. Hard stool partly come out, then again recedes back. This is very peculiar symptom of few medicines. More than one medicine are there. Silicea also has that medicine. Stool come out, then again recede back. Silicea for urinary symptoms. Passive inflammation of kidneys. Urine full of pus and mucus. After febrile diseases, urinary troubles as said ahead. Red sediments like brick dust in urine, uric acid, nocturnal enuresis due to worms. With this, the video ends. Thanks for listening, viewing. Any problem, please report it to the comment section. I will certainly respond. Silicea for pregnancy symptoms. Mastitis. Mastitis is inflammation of breasts. Just before caking, if Silicea is given, pus cannot be produced. For initial stage, calamure is best medicine. Nipples cracked, painful sore. From fistula of breast, thick yellow discharge. This is the picture. Thick yellow discharge. Sore pain from instep to heel. Instep is the just curvature of the feet, that is instep, from there to up to heel. During pregnancy, Dr. Kent remarked To eradicate the tendency to miscarriage or inability to conceive in women, Silicea is very efficacious. Please remember this saying of Dr. Kent. Silicea for respiratory symptoms. If third stage of pneumonia, in third stage of pneumonia or empyema is pus formation in the pleural space, or tracheitis or chronic bronchitis or tuberculosis with severe weakness, profuse night sweat, where calcarea, phos and natrium is also used. In every or any type of chronic disease where copious yellowish green pus discharge with titillation in throat and pit of stomach and disturbing cough which get worse in night while lying down after cold drinks with sensation of hair tucked in tongue, Silicea is the remedy. A big line, please read this line many times. You can see the depth of the wideness of the disease symptoms. In every or any type of chronic disease where copious yellow green pus is discharged with titillations in throat or pit of stomach and disturbing cough where it gets worse in night while lying down after cold drinks with sensation of hair tucked in tongue, Silicea is the remedy of choice. In liver abscess too, Silicea brings cure soon with resolution of the boil. This is the picture. Life case, female baby aged 4 years. Had been suffering from stomach trouble for last 7 to 8 months. Limbs of the baby were as thin as stick, but head was large. Anterior fontanelle was still slightly open. Abdomen was larger too. Her spine was scoliotic. Scoliotic means this is not this type of spine. Though this boy is not of 7 to 8 months, they may be 4 to 5 years. But this is the scoliotic spine. Spine is carved. Her spine was scoliotic, no trouble of teeth, no history of bedwetting, but wanted to eat always. Did take enough of foods, but body was as thin as ever. Face pale, scalp wet, copious with fetid sweat. Her ma reported stool of the baby had carrion-like odor. Color always changing. Her mood was irritable and whining type. Liked to lie down most of the time. Used to suffer from fever in new moon and full moons. On examination, it was noted that limb glands of the groin swollen but not painful. Silicea 30x 1 dose, 1 grain. In a week, for 4 weeks, with report after 2 weeks was advised. In due time, message arrived. The baby was doing well. Her stool was normal. The fetid odor gone. Used to pass once a day in the morning. She now spent her time with toys and her peer group. Thereafter, the patient party did not report. Actually, the patient was strongly of tubercular diathesis. That is, he has inherited tubercular background. So this is called in homeopathy, or particularly in homeopathy, this term is used. This is called pseudosora or scrofulosis. And Silicea is almost infallible in this case. I am sure the patient has got cured completely. That's why the patient party did not report, I'm sure. With this, the video ends. If you got anything to say, please write down in the comment section. I will certainly reply. Thanks for listening and viewing.